And welcome to this final lecture about the case history of a young patient presenting with sudden onset of shortness of breath, chest pain, and high pulse rate. So far we have discussed about the X-ray ECG findings and investigations of the differential diagnosis in this patient. We were mainly focusing on emphysema, which is the most probable diagnosis in this patient. Now in this slide we'll be talking about complications and management of emphysema. So starting with the complications of emphysema, these include pneumonia or chest infection. In patients who have got emphysema, there is a high chance of recurrent infections of the lungs involving the alveoli and the bronchioles or the smaller airways. People with emphysema are more prone to development of pneumonia. In addition, they can develop collapsed lungs. Some lungs develop large air pockets called as bullae, which may burst, resulting in pneumothorax, which is the air in the pleural cavity, the cavity around the lungs and the chest wall. Heart complications. Due to damage to the alveoli and small airways of the lungs, reduced number of capillaries, and lower oxygen levels in the bloodstream, what happens is that the heart has to pump harder to move the blood through the lungs. Over a period of time, this places considerable strain on the heart, especially on the right side of the heart, and that can lead to right-sided heart failure, which is called as cor pulmonale. Now let's talk a little bit about the treatment management of emphysema. There is no cure for emphysema, unfortunately. However, appropriate management steps can reduce symptoms, improve the quality of the life of the patient, and reduce progression of the disease, and help the patient stay out of the hospital for a longer period of time. Some important management steps include stopping smoking immediately and completely. This is the single most effective treatment for COPD and emphysema. The patients are encouraged to stop smoking, and they may need to join a support program to help them for this. Secondly, avoid any exposure to air pollutants that can also damage the lung architecture and progress the disease. Pulmonary rehabilitation programs. These are also arranged by different hospitals at government level, and they help regaining some function in terms of lung functioning and support to the patients. Oxygen treatment. In case of advanced cases, when the oxygen levels are dropping, patient may be given oxygen artificially in order to keep their saturation levels up to help provide oxygen to major body organs. Medications for emphysema. Medications usually include anti-inflammatory medications, medications to widen the airways, which are called as bronchodilators and loosen the phlegm, antibiotics to treat chest infections, gentle regular exercises to improve overall fitness, influenza vaccination yearly, and pneumococcal vaccination to protect against certain types of respiratory infections. Respiratory rehabilitation programs. A person with emphysema can take part in respiratory rehabilitation program, commonly known as pulmonary rehab. These programs provide information and education on emphysema, introduce people to a supervised exercise program proven to improve emphysema symptoms, improve lung functions through specific breathing exercises, teaches the patient stress management techniques. In addition, they offer advice on adapting to live with emphysema and provide emotional support through shared experiences. Oxygen treatment for emphysema. If a patient with emphysema is found to have exceptionally low levels of oxygen in their bloods, they will be given oxygen therapy to use at home. The oxygen is usually breathed through the nose via nasal prongs or cannulae. The person will need to use oxygen treatment for at least 16 hours every day. This is also called as long-term oxygen therapy. And finally, if everything else fails, the definitive treatment for emphysema in an advanced stage, if these medications and this treatment fails, is lung transplantation, which in itself is a complicated process, and it has got also a lot of complications, which we will be discussing in some other slide or case history. Thank you very much for watching, and I hope you learned something about chronic airway diseases. And just to remind you, all the images which have been included in this teaching slides have been anonymized. The data has been anonymized and consent was taken from the patients to use their slides for teaching purposes. Please do subscribe to some of other courses which you will find more useful, and that will help you build up your experience and knowledge in terms of different subject matters related to medicine. So thank you very much for watching and have a nice day.